Cardiothoracic surgeon, Dr. Divyakant Gandhi. Welcome to the show.
Thank you for having me.
Yeah, nice to see you. Nice to meet you today.
Yes, you've been working here for 25 years, and first time we meet.
And you're fairly new here at Henry Ford.
I'm a rookie here, yes.
Oh, great. Well, it's a specialty, I think. A lot of people don't really know what cardiothoracic surgeon does. Tell us a little bit about what that specialty is.
Well, cardiothoracic surgery involves operating on patients who have heart, lung, and occasionally esophageal conditions. That's restricted to the thoracic cavity. So we call it cardiothoracic surgery.
So it's pretty much, it's your torso. Everything in your torso?
Exactly, from the neck to the diaphragm.
Wow.
In between.
So heart,
lungs,
esophagus,
and some conditions of what we call the mediastinum. That's the middle of the chest there, where the thymus gland, for instance, or some lymph nodes might be enlarged that we need to do a biopsy.
Well, this is one of the most intense surgical specialties going. Why did you choose to get into cardiothoracic as a specialty?
It's a long story, but when I was young, my father was very keen on broadening my knowledge, and that was when I was in high school in Kampala, Uganda, where both my parents were physicians. And he always bought these magazines, Life magazines, and Time and all, to make sure that I read and I got good at English and things like that. And this was about 1965, 66, when cardiac surgery, heart surgery, was just coming into fore with the development of the heart-lung machine. We call it cardiopulmonary bypass machine by Dr. Gibbon. And this was the saga that was documented by James Thompson, who was a resident in Baylor University way back in the 60s in Houston, Texas. And he documented the saga between Denton Cooley and Michael DeBakey, two giants who brought cardiac surgery to the fore.
Heart transplant surgeons.
Heart transplants too at the end of the day, which was after 67, of course. But when I read those articles in Life magazine, it inspired me. And I went down to my mother and I said, I want to be the third best heart surgeon in the world.
Wow.
And of course, she said, well, why not number one? And I said, that place has been taken by Denton Cooley and Michael DeBakey. But that dream remained in me. And I went to medical school ultimately in India, Mumbai, but could not progress there when my parents by that time were relocated in England. So I went to England, was there for about 6 years. Again, I could not progress much. And so my father insisted that I should move to the United States. And that was the right move, because soon after I came here, the professors were really impressed, and they said, what do you want to do when you grow up? And I said, I want to be a heart surgeon. And they said, go ahead and apply, and we'll make it happen. So here I am after 40 years doing heart surgery.
No kidding. So when you were in Africa, wasn't it Dr. Christian Bernard that did a heart?
Oh, that's a good point. Yeah, Christian Bernard was in South Africa, Groote Schuur Hospital, November 11th, I think, 1967, when he did his first heart transplant. But interestingly, he did his training at University of Minnesota, where he was a fellow. And then they put him in the animal lab, and he learned all the techniques that the great Dr. Norman Shumway had developed in the animal lab, how to do a heart transplant. He took those techniques and did the first heart transplant.
Well, I would say we're blessed to have you here in our community.
Well, I'm blessed.
Are you so today, are you the third best?
No, no way. Nowhere near third best.
All right.
But
well, you're
I'm inspired by so many teachers and so many innovators in heart surgery. It's a young specialty, you must remember. It started in the 1960s.
Have you done any heart transplants?
Yes, when I was a resident in Milwaukee, yes, number of heart transplants. But you need to be in a specialized center to be able to do that. You need a certificate of need, and United Network Organ Sharing decides. And we've got 3 centers in Michigan doing it. Henry Ford, Maine, University of Michigan, and of course Corwell. It used to be Spectrum, but now called Corwell.
And there's such a thing as heart-lung transplants too.
There is, and that's a specialized problem, which, very rarely we need to do, but yes, that is maybe necessary to do both at the same time.
So today we're talking about heart health because February is National Heart Month, Heart Health Month, Women's Heart Health Month. So maybe you have some suggestions, or even one. We can take one. I think if we can just do one to improve or to work on our heart health.
I would say smoking. Mm-hmm. I know the trends have been down with the various enactations by the federal government, not to smoke in restaurants, not to smoke in offices, things like that. But still, smoking is the number one problem as far as heart conditions are concerned, and if we can cut that back significantly. By smoking, I also include vaping, by the way, which is perhaps even worse than smoking.
Vaping is worse than smoking?
That's what I believe.
Really? Wow.
And the reason is simple. When you smoke cigarettes, it's a hot smoke. Mm-hmm. So you don't inhale too far in. When you vape, it's relatively cold. I've never vaped, but I don't know. But whoever tells me, they say it's cold. So you inhale much deeper, and there's a higher concentration of tobacco or nicotine. And there are micro, what I call small particles that go far out into the lungs and damage the lungs, to the extent that CDC had a report that showed that the lung transplants in teenagers had skyrocketed over the last 15 years related to vaping.
Have you seen vape damage in lungs?
I've seen a few younger patients who came to me with blebs in their lungs, and I think that those were related to probably vaping.
How does someone end up in your office? Do you have someone, your doctor, maybe your cardiologist refers a patient to you for specific surgeries? Yes.
So typically the patient has already been fully worked up. Mm-hmm. So all I have to do is to look at the films and say hello to the patient and explain to them what the problems are, and of course clinically examine them. But typically cardiologists have worked them up, or a pulmonologist have worked up the lung condition, and I get to see them in the office and spend a lot of time explaining, because as you can imagine, there is a lot of anxiety when they come to know my heart is in trouble.
I'm hearing there's tuberculosis is back, emphysema is more frequent. Are you seeing these?
I have not seen much tuberculosis because most of the treatment is medicines now. We have those. But yeah, emphysema has been, I thought it was getting curtailed, but we're seeing some rise in it. And I wonder if that again is because of vaping.
Do you use robotics in your surgery?
I work robotics with doing lung surgeries and esophageal surgeries, definitely. It's a phenomenal technology, because the chest is a relatively rigid structure. Mm-hmm. And if you have to open it and get your hands in, you got to open it wider. Mm-hmm. And that's related to other issues like pain and sometimes complications, whereas with robotic, you can make 3 small pinholes. And now the technology has evolved that you may need to only make 1 pinhole and do everything through that.
Amazing.
It's phenomenal. Mm-hmm. And by the way, the advantage of robotic is that it's 3-dimensional. It's 3D binocular vision. So you can see everything. You have depth perception, which you did not have. And the other one technology that has improved is it gives you the feel. When we go inside with our hands, you can feel the structures. Mm-hmm. With robotic, you couldn't. But now they've developed a technique where if you use a forceps or whatever instrument, you can get the feel in your fingers. Mm. So that makes it somewhat easier.
So you can feel there's a resistance in the controls now.
Exactly.
Wow.
Somewhat like that, yes.
What's the most rewarding part about being a cardiothoracic surgeon?
I think it changes the lifestyle of the patient. The quality of life improves significantly, and it impacts the whole family. Mm-hmm. If you think about it, and that's what's most gratifying to me, is to see the family get back on their feet, and if there's the sole breadwinner, then that helps them get back to work. And to me, that's the most gratifying thing.
That's got to be. And you've extended people's lives. I'm sure for a lot, it's a miracle.
Yes, and they get back healthier, stronger. They don't have shortness of breath. They don't have chest pain. They're able to do any activity they wish to do after a certain period of time. So, to me, that to see that, and then 10, 15 years later, patients still writing to me and say, "Thank doc," that just brings goosebumps.
Yeah, that's got to be awesome. Well, we are so glad you're in Jackson, and we thank you for coming in and being on our show today.
Thank you for having me. I appreciate it.
You bet. New with Henry Ford Jackson Hospital cardiothoracic surgeon, Dr. Divyakant Gandhi.